Let's talk about Forxiga, also known as Dapagliflozin, a medication used to treat type 2 diabetes, heart failure, and chronic kidney disease. It belongs to a class of drugs called SGLT2 inhibitors. Here's how it works. Your kidneys normally filter sugar out of your blood, but reabsorb most of it back. Forxiga blocks this reabsorption so more sugar gets passed out in your urine, lowering your blood sugar levels. It also helps your body get rid of extra salt and water, which can reduce strain on the heart and kidneys. Forxiga is taken once daily, with or without food. It's often used with other diabetes medications like metformin or insulin. Beyond diabetes, Forxiga is also approved for heart failure with reduced ejection fraction, chronic kidney disease to slow its progression. Common side effects include urinary tract infections, genital yeast infections, increased urination, low blood pressure, or dehydration. Rare but serious risks include diabetic ketoacidosis, DKA, even with normal blood sugar, kidney problems, or increased urination risk in elderly. Forxiga is not recommended in people with type 1 diabetes, patients on dialysis, during pregnancy, or breastfeeding. Bottom line, Forxiga offers blood sugar control, heart and kidney protection, but requires careful monitoring. Talk to your doctor to see if it's a fit for your treatment plan. If you found this helpful, hit like and subscribe for more medical animations.